Welcome to Epoch News. I'm Tatiana Darzi. Belgium, a small country in Europe, has a population of about 11 million people. However, it has one of the highest death tolls of the CCP virus. Although the country's death toll is rising, King Phillippe of Belgium continues to applaud how the Chinese Communist Party, CCP, handled the virus outbreak and thank the Chinese regime for being a true friend.
Belgium, a small country in Western Europe, potentially has the highest mortality rate of the Chinese Communist Party CCP virus, commonly referred to as the novel coronavirus, in the world. While the country is being hit hard by the CCP virus, King Phillippe of Belgium continues to applaud how the CCP handled the virus outbreak. In today's episode, we will be looking at how Belgium has maintained a close relationship with the CCP over the years. Belgium has a population of approximately 11 million and a territory of about 30,000 square kilometers. However, it presently has the highest death tolls of the CCP virus at almost 14% higher than the rest of the world. Chinese independent scholar Ge Bidong expressed that the virus seems to have exposed the countries that have strong ties with the CCP. The countries that are close to the CCP have a lot more confirmed cases of the CCP virus.
The relationships of European countries with the Chinese Communist Party involve huge interests, and these countries make decisions regardless of the political system in China. They know that the CCP is an evil regime, but still choose to ignore this fact and continue supporting them. As a result, they are going to suffer.
The diplomatic relationship between China and Belgium was established in 1971, and since the year 2000, both governments have been cooperating closely. The Belgian government has been advocating the CCP's Belt and Road Initiative, and former Prime Minister Yves Leterme and former Deputy Prime Minister Chris Peters are advocates of the project. Unlike many Western politicians who have chosen to not voice their opinions about the project, the duo have not only promoted the Belt and Road Initiative publicly, but also urged other members of the United Nations to actively participate.
Many years ago, the president of Belgian-Chinese Chamber of Commerce, Bernard de Witt, wrote an article to show how Europe's close relationship with China has profoundly influenced the entire region.
Facing the UK and bordering the Netherlands, Germany, Luxembourg, and France, Belgium is at the crossroads of Europe. But with its west side exposed to the North Sea, it is a strategic target of the CCP. Leterme praised the CCP in an interview with Chinese state-run media in October 2019 and referred to the CCP's infiltration of Western countries as an important and positive contribution in the establishment of order in the New World. He mentioned that Belgium is an entry point to European markets, with multiple airports and ports connecting to the rest of Europe. He even urged the Belgian government, on behalf of the CCP, to further study the great opportunities brought by the Belt and Road Initiative. Belgium's port of Antwerp is the second largest transport hub in Europe and has proximity to European production and consumption centers. In August 2015, the Belgian government established an ad hoc working group at the port to support the CCP's Belt and Road Initiative. In early 2018, Belgium's second largest commercial seaport, Zeebrugge, also signed a container terminal concession agreement with COSCO Shipports Limited of China under the Belt and Road Initiative framework. In addition, Belgium also offers China its high technology. For example, Belgium is a global leader in microelectronics research. The Belgian Microelectronics Research Center and the University of Leuven have signed cooperation agreements with numerous Chinese companies to develop nanotechnology and 5G network technology. According to reports, as of 2018, both governments have cooperated in more than 470 technology projects. In 2010, Geely Holding Group in China acquired all stocks of Volvo Car Group worth $1.8 billion, as well as Volvo's largest assembly plant outside Sweden in Ghent, Belgium. The engineers and experts from the Ghent assemble plant then selflessly passed on their skills to the workers at the Volvo's new factory in Daqing, China. Over the next several years, a large number of Volvo cars were released to the European market with the label Designed in Ghent, Made in China. This is a perfect example of the CCP's ultimate goal to use its acquisition of companies in order to steal technology. Belgium also joined the Asian Infrastructure Investment Bank, AIIB, managed and directed by the CCP in 2017. In 2018, the trade volume between China and Belgium stood at $23.3 billion, 1,150 times higher than since the establishment of diplomatic relations. In November 2019, the largest Belgian economic and trade delegation of all time and Princess Astrid of Belgium personally visited China with the hopes of obtaining more Chinese investment. Just like many other countries, Belgium accepted China's panda diplomacy as it welcomed two giant pandas, Xinghui, meaning sparkling star, and Hao Hao, meaning nice, who later gave birth to a male panda. The CCP virus outbreak led to a global pandemic because of the regime's cover-up. Belgium has lost many lives to the virus. As of April 22nd, Belgium has nearly 42,000 confirmed cases of the CCP virus and 6,262 deaths. The mortality rate is as high as 14.95%, the highest in the world based on current available data. Despite the international scrutiny the CCP is now facing over the pandemic, Prince Phillippe claimed that the CCP's experiences in handling the epidemic have been helpful to Belgium and thanked the CCP for being a true friend when it sent much-needed medical supplies. However, Belgian media later exposed the poor quality and low standard of 3 million masks imported from China. Ge Bidong said that the actions of pro-communists have attracted the CCP virus to their country during the pandemic. He added,
"That is why I said that the world needs a change, and that is to stay far away from the Chinese Communist Party, denounce and eliminate the CCP. In this way, we are able to find a solution to truly cure the virus worldwide because the Chinese Communist Party is the most deadly virus in the world."
Presently, the Belgian government is still considering participation in the Belt and Road Initiative. Various commentators have said the CCP virus pandemic should serve as a warning to Belgium and its leaders as it reaches a critical stage in its decision.
Countries worldwide have had to rethink the risks of having economic trade with the CCP. Japan and the United States are taking important steps to speed up the process of decoupling from the regime. China has lost its credibility, and there are many factors directing companies to move their companies back to the U.S.
The CCP virus pandemic has forced all countries across the globe to rethink the risks of having economic trades with the Chinese Communist Party, CCP. Among these countries, the US and Japan are taking some important measures to accelerate the process of decentralizing from the CCP. Presently, a renowned Japanese brand, Iris Oyama, may be the very first company to receive subsidies from the Japanese government's supply chain restructuring program. They are planning to move the production of non-woven fabric, the raw material for facial masks, from China back to Japan in order to increase the local productivity of facial masks. On April 9th, the Japanese government declared that it has $2.2 billion in funding to assist Japanese companies returning from China and resettling in Japan or other countries in Southeast Asia. On the same day, the director of the United States of Economic Council, Larry Kudlow, suggested that the U.S. should help pay for the costs related to the relocation of those American companies that want to leave China.
Many CEOs and companies are moving forward on that without any kind of government assistance because they don't regard China as reliable and trustworthy any longer. And made in China is just not a seller for the United States anymore. And so there's a lot of forces that are moving towards bring it home, made in the USA.
In addition to the reassessment of supply chain management, the U.S. financial sector is also now re-examining the risks of Chinese companies listed on the stock market. On April 21st, the chairman of the U.S. Securities and Exchange Commission, Jay Clayton, the chairman of the Public Company Accounting Oversight Board, William Dunk, and 3 other individuals issued a joint statement warning investors of the financial risks of Chinese companies. Due to the lack of transparency in the financial reports of Chinese companies over the past years, it is very unlikely that the investors will be compensated when things go wrong. Experts believe that this CCP virus pandemic has urged countries to rethink the risks of dealing financially with China and the importance of decentralization with China. Senior Director of the National Interest, Harry Kazianis, said,
as you see more of these supply chains leaving China, going back to the United States, back to other countries, they're going to have less of a reason to say nice things and do nice things with China. And I think you'll see things change pretty quickly after that.
In China, it's been reported that doctors from a hospital did testing on more than 200 samples from patients, and the results suggested a false negative rate of about 30%. This is a high rate of error. This shows that many people infected with the virus might have been misdiagnosed and were not included in the statistical data.
A 52-year-old Wuhan resident, He Ximing, had been having symptoms of the CCP virus since February. 4 tests have been done in the past 2 months. The results of the first 3 tests were all negative, and the last time it was positive. Doctors in mainland China found that the false negative rate reached about 30%, which calls into question the CCP statistics about coronavirus testing. By the time Mr. He's test results confirmed he was infected, the X-rays already showed white blotches all over his lungs. About 2 months ago, Mr. He started to suffer from breathing difficulties and chest congestion. However, the 3 nucleic acid and throat swab tests were all false negatives. Based on these false negative results, the doctor told him that it wasn't the CCP virus. Mr. He said he trusted the negative test results at the time, but looking back, he felt scared and worried because he had not taken any isolation measures in the past 2 months. Fortunately, his wife was not infected. He later took the 2nd, 3rd, and 4th tests because he didn't have any improvement after the first test. Even medicines didn't help. On March 28th, he got the 4th nucleic acid test and it was a positive result. However, the throat swab test was still negative. However, misdiagnosis like this did not just happen in He Ximing alone. It's reported that, in February, doctors from a hospital in mainland China did a survey on more than 200 patient samples. The results suggested a false negative rate of around 30%. He Ximing said besides the physical pains, he's more worried about infecting others. I don't know how many people were misdiagnosed with negative results. The high error rate of the tests makes the public worried that a lot more people have actually contracted the CCP virus, but they have not been included in the statistics data.
Chinese authorities are forcing citizens to present health barcodes on their phone to identify a person's health risk level related to the CCP virus. While people who have green barcodes representing good health may feel happy about the system, others realize that barcodes indicating a health risk make civilians more vulnerable to the regime's inhumane control measures.
Chinese authorities have instigated health barcodes that use 3 different colors to identify a person's health risk level. Red indicates a person who is confirmed or suspected to be infected with the CCP virus. Yellow indicates a person who has come into contact with a confirmed or suspected patient. Green indicates a person who has never been infected and has no contact history with potential virus carriers. Many people who are holding the green barcode feel happy about this identification system, thinking it is equivalent to a certificate of health. However, a Chinese woman realized that this system makes civilians more vulnerable to China's inhumane epidemic control measures.
Friends, today I just realized the purpose of the health barcode. It is not a certificate proving that we are healthy. If that was the purpose, would authorities allow us to fill out the health information ourselves when the barcode card was given to us? It is an electronic ID system that tracks our movements and whereabouts. That is, when you scan your barcode before entering a supermarket, it appears that a staff member is looking at the scan result at the front desk. But in reality, at the same time, your whereabouts are being tracked electronically on a remote system. For instance, if you visited a shopping mall and someone inside the mall was later diagnosed with a novel coronavirus, the remote electronic system tracked all those who were inside the mall during that time frame, and your green barcode would be degraded to yellow or red. That is not the worst thing about the system. What's really terrible is that your community staff treat you as an enemy. They will come to your home, measure your temperature, and then take you to a place for isolation. You can't self-quarantine at home. You are sent to a centralized isolation facility where you stay with other people who may be infected. You have to pay the cost of staying there. Therefore, people like us must be very careful as we live paycheck to paycheck and are the main contributor to our household income. Think twice before you go anywhere and before you scan your health barcode. Do I really need to visit this place? Are the people here trustworthy? Do not visit any place casually. Take this seriously.
What she said is very true. The health barcode system has turned China into a big data prison. Everyone is wearing electronic shackles and risks the danger of mandatory quarantine and discrimination at any time. In a recent video taken in Wuhan, everyone on a bus had to go to a quarantine site because one person with a red health barcode was on the bus.
这里嘛610嘛掉了大，我去，这里嘛整个车人全部的嘛都拦下来了，都不让走了，都要去隔离。这再这还有万子人。
Located in China's northeast, the city of Harbin has become the new epicenter of the CCP virus pandemic. A resident from the area, Mr. Yu, explained how he and his wife were both harassed by police because of their online messages about the CCP virus. He says the government doesn't care about its citizens since there isn't any kind of relief aid and many people are struggling financially.
Harbin City, capital of Heilongjiang Province, located in the northeast of China, becomes the new epicenter of the CCP virus pandemic following Wuhan. Mr. Yu is a Harbin resident. He and his wife were both harassed by the police because of their online messages about the pandemic.
What I know is that many apartment complexes have been closed. Even individual apartment buildings have also been sealed and locked. I don't know if it's because of a suspected case. All I know is that the alert has been way up to a scary level in the Daowei district. It feels really horrifying.
No specific reason was given?
It was said to be an imported case. This person had sexual relations with her neighbor and as a result ended up spreading the virus to several people. The government did not comment on this and did not restrict the discussion either.
How serious is the shutdown of the complex?
The guards stand watch at the checkpoint nearly 24 hours a day. When the outbreak first began, the guards would only stay until around 7 p.m. Now they are still there at 12 a.m. They also make it mandatory to scan people's health codes. Overall, the alert level has gone up higher than it was at the beginning of the pandemic. For several evenings, I tried to find out what's going on at the CDC and the ambulance dispatching, but the checkpoints are guarded past midnight. There are also police patrolling at the intersections. There's no way I can get past them.
It was said 18 officials in Harbin, including a vice mayor, were punished because of the huge reoccurrence of the infection.
I have heard that. But no one knows exactly how many people have contracted the virus. There were only cases being told among folks. The government hasn't said anything about it. The media have also been completely silent about it. In Wuhan, there was a writer Fang Fang and her Wuhan diary. Here in Harbin, there's no way you can write anything. I was harassed by the police at the beginning of the outbreak. My wife was also threatened by them. They would not allow anyone to voice their opinions on issues regarding the pandemic. They won't allow me to send any messages. I told them that at least I have to be able to keep in touch with my relatives or friends. They are watching me very closely. Whenever I send some text message out, they would call me right away.
What about people around you? What's on their mind?
People in Harbin take my friends as examples. Many of them are struggling to make ends meet when it comes to money and food. In a couple of months, they might be completely out of food. To those who have mortgages and car loans, some of them might delay the payment during the pandemic. But to those who live on wages, not being able to work means no earnings. The bank would not reduce the interests. The government doesn't care about any of us. There's no relief or aid. There are many people struggling. A friend of mine is running short on cash. Pretty soon, food will become a major issue. To many of them, it's not about preventing the infection or how not to contract the virus. It's about their livelihood. It's about surviving the pandemic. That's the urgent issue.
The interview was conducted on April 19th by Chang Chun of the Chinese language Epoch Times.
On Friday, President Trump began his press briefing by stating that the U.S. is seeing evidence that their aggressive strategy is working. Nationwide, the percent of tests coming back positive have been declining significantly.
We continue to see evidence that our aggressive strategy is working and working at a very high level. Nationwide, the percent of tests that come back positive has declined very significantly. Last week, roughly 38% of the tests in New York were positive. This week, that number is down to 28%. New cases in New York are down 50% compared to a week ago, and fatalities are down 40% over the same period. In Louisiana, the rate of positive test resulted declined from 25% down to 15% in the last 7 days alone. 18 states now show a decline in a number of positive tests in the last 7 days. So over the last 7 days, been very, very significant progress.
Half of all Americans live in states that have taken steps to open their economies. Americans are asked to remain vigilant, maintain hygiene, social distancing, and voluntary use of face coverings.
Half of all Americans live in states that have now taken steps to open their economies. Just yesterday, Governors Gavin Newsom, California, Tim Walz of Minnesota, and Bill Lee of Tennessee announced additional plans to restart certain sectors. We ask every American to maintain vigilance and hygiene, social distancing, and voluntary use of face coverings. We're opening our country. It's very exciting to see. We have a lot of talent involved, from governors down to people that just stand there and help you with the doors. There's been tremendous talent involved and tremendous spirit from our country.
Trump goes on to say that on Friday he signed the Paycheck Protection Program and Healthcare Enhancement Act that will benefit small businesses, minorities, and hospitals.
Today I signed the Paycheck Protection Program and Healthcare Enhancement Act, providing $320 billion to keep American workers on the payroll. $30 billion of the Paycheck Protection funds will be reserved for small financial institutions, including those that serve minority and distressed communities, extending vital relief to thousands of African American and Hispanic American small business owners and their employees. The bill also delivers $75 billion for hospitals, so badly needed for hospitals. They've taken a very big hit. And medical providers in areas less affected by the virus. Hospitals and doctors should work with their state and local health officials on ways to safely resume elective medical treatments and care.
The following charts will show you the most recent numbers regarding the CCP virus pandemic. However, China and Iran are not included because their numbers are unverifiable. That's all for today. Don't forget to like, subscribe, and share this program with friends and family to keep them informed about the latest news and updates. Thank you for joining me. See you next time.